Hey guys, this is Luis Moreno with 360 Insurance Group. Today I'm sitting with Sonia Porras. She is the rep from Friday Health Plans. And we're going to be talking about ACA, more particularly about this new SEP that is an income-based SEP that we can utilize all year long. And then we're going to talk about the plans that Friday has available for us to sell to insureds in Texas. So let's start off with one hot topic. Which carriers out there are paying commissions? I'm not going to talk about all of them, but there are a bunch of them that are not paying commissions. But Friday Health Plans is paying commissions. So that is a huge thing for you guys to know. So if you write a health plan for an insured with Friday, you're going to be paid health commissions. But if you write them with some other carriers, you may not get paid. So if you want to know what those carriers are, hit me up and I'll tell you. Now, as far as this income-based SEP, let's talk a little bit about that before we get into the actual Friday plans. So what can you tell us about this new income-based SEP?
Well, it just went live on the marketplace on Friday, so it's now available on Healthcaregov as well as Health Sherpa. Should be available in other EDEs that you may be using as well. And pretty much it's brand new. If someone has an income below 150% of the federal poverty level and they're also eligible for a subsidy, this gives them the opportunity to enroll now. They don't have to wait for the next open enrollment. They can enroll new. They can even change plans if they're already on a marketplace plan, and they can do this up to once per month. Obviously, don't want to encourage too much changing around, but it is an opportunity to get some new folks on the books, as well as to change plans. If someone is unhappy with another carrier, they can move on over to Friday and you will get paid for that enrollment during the SEP. It follows accelerated effective dates. So if they enroll by the end of the month, their coverage starts the first of the next month. So they have until the end of March to enroll for April 1st effective date, end of April for May, and so forth.
Are we going to have this accelerated every single month?
Yes, that is our understanding from the marketplace.
So this is huge, guys. What used to happen in the past is if you enrolled somebody after the 15th of the month, they would get an effective date, not of the first of the following of that next month, but the following month. Now it's a little bit different. So if we get somebody on 3/31 that meets the income categories, we write them right now, they're going to have a 4/1 effective date.
Yes, and obviously allowing for processing time and things like that. They're not going to have their ID cards right away, but the effective date will be honored for 4/1.
Correct. Now, the downside to the 3/31 enrollment or the end of the month is that, yes, it's going to take a little bit of time for the information to go from healthcare.gov to the carrier, for the carrier to process it, for the payment to get applied, and then for the insured to get their ID cards.
Exactly.
But they're covered effective the first of the month. Any claims, I guess, will get backdated, and here goes the messy claim process.
Exactly.
So try to get them done early. Okay, so that's huge. Now, the other question you're probably thinking, Sonia, you said 150% of what?
Of the federal poverty level.
Okay, so that's huge, guys. You got to know what the federal poverty level is. If you don't know what that is, hit me up and I'll share my chart. But there is a national chart, and I think it works for the majority of the states. There's a few outlying states that have their own charts. But with this income chart, what's going to happen is there is a 100% level, and it goes all the way up to 600%. For this SEP, it's only going to work for 100 to 150%. Okay. And I'm going off memory, but I think a family of four, that 150% is very, very close to $40,000 a year.
Sounds about.
So somewhere in there, and I have it on my chart, I just don't have it memorized, but be aware.
I think it's in the Smartbook.
It is in my Smartbook. So for agents that are contracted with us, I've got an ACA Smartbook that I've created with all the information that you need to write health plans. And I have that chart in there, and I also have it highlighted between 100 to 150%. So, but I don't have the book with me right now. So let's hop into these plans. So guys, what we're sharing with you right now is a PowerPoint from Friday Health. We're going to talk to you about health plans in Texas. So let's rock and roll, Sonia.
Yes, absolutely. So Matt, if you wouldn't mind. Just a little bit of background about Friday Health Plan for those of you who may not be familiar with us yet. We were established in 2015 in Colorado. We're now in 7 states. Texas is by far our largest membership state. We're a unique brand, though, combining 47 years of operational experience with innovation. So even though the company, as Friday, is technically 7 years old, we actually acquired a Colorado Choice Plans in Colorado in 2015 and kept a lot of those folks on. So we have people on the team with 20, 30 plus years of operational experience, underwriters, actuaries, service folks. So we actually have a lot more experience on our side than maybe evident by just a 7-year-old company, which puts us ahead of our competitors in that sense. Friday is certified as a qualified health plan issuer on the health insurance marketplace. So we are an ACA approved plan. We have one set of plans and one network to use. So there are some other carriers out there with kind of tiered networks, maybe some of their cheaper plans have a more limited network, and that can be a little bit messy. We want to keep it simple for you and your clients. So all of our plans use the same network within Texas. A client in Houston can travel to San Antonio and they can use their Friday plan year.
Yes, and I will tell you, there are some carriers in there that do have separate networks, and that is super confusing because one carrier has a value plan and a regular plan, and insurance. Well, I'm going with this value because it's almost the difference in premium is huge, but then come realize that network is super narrow.
Exactly.
All the doctors that they had on this regular plan, very few of them are on this limited network plan. So it's a good thing with Friday that we only have one network to deal with.
Yes.
Matt,
they're either in network or they're not. We keep it simple.
Correct.
And so just a general overview, we know open enrollment ended January 15th, but the increased tax credits from the American Rescue Plan continue through 2022. Friday saw almost 400% growth in Texas during this open enrollment period. So thank you to those of you who are already writing with us. If you're not, please get with Luis about getting set up to do that. And we are in 20 counties of Texas currently, and we'll show you which ones those are here shortly. But there's a lot of opportunity during the special enrollment period this year. Of course, we have the normal special enrollment opportunities like losing coverage, moving, marriage, divorce, birth, or adoption of a child. But what we expect to see the most out of is this new monthly SEP for individuals with income below 150% of the federal poverty level. So let's talk more about that. They do have to be subsidy eligible still and have household income under that qualifying amount. So just bear in mind, it's not every single person whose income falls below those numbers. They do still have to be subsidy eligible. So if they have coverage through a job, that can disqualify them. If they're Medicaid eligible, that can disqualify them. So just be on the lookout for those cases. But if you have someone who's subsidy eligible and their income falls under that amount, then you have an opportunity to enroll them new or change plans for them if they're unhappy with their current marketplace plan.
So to get 2 big points here. Number one, guys, if they're under that 100% level, they're out of luck. In some states, in Texas, we didn't expand Medicaid, so they're truly out of luck. In some other states, they're going to qualify for Medicaid. So if they're under that 150, it's not going to work. Okay. Also, if you're thinking, man, I missed open enrollment, it shut down January 15th. Well, guys, we have a year-round enrollment. So the ship kind of sailed and then it came back to port. So you have an opportunity to still write a ton of business and build your book up. So guys, don't think that the ship has sailed. We are back in the game starting now.
Exactly. Yes. And this slide actually hasn't even been updated since Friday because it already went live on healthcare.gov and the EDE starting in late March. So go ahead and get started writing. You can already write business for April 1st under this special enrollment period. And it was, as we mentioned earlier, it's going to follow the accelerated effective date schedule, just like a loss of coverage qualifying event. If they enroll by the end of the month, they'll have coverage the first of the upcoming month. And we're excited that we're going to continue to pay commissions throughout the year.
Great. Love those commissions.
Yes, definitely. So here are the 7 states where Friday currently offers plans. Texas, of course, Colorado, where we started. We also have New Mexico, Nevada, and the 3 new states that we added in 2022 are Georgia, North Carolina, and Oklahoma. We're currently looking at adding 4 other states for 2023. We're not quite ready to announce those yet. They're pending state approval, but be on the lookout for some exciting expansion for the upcoming plan year as well.
Now, for an agent in Texas, and assuming they want to go maybe to New Mexico or Colorado and sell, new contracting needs to be done for them?
Yes, they would have to be licensed there, of course, and then they would have to add that state to their contract. So just reach out to our broker support team if you're interested in adding states where you're licensed and where Friday has plans to your appointment, and we can get that done for you.
Great. Let's just scroll down.
And here are the 20 counties where we have plan options in Texas. So as you can see, we're in Bexar County in San Antonio. That's where we are right now. We're in my home turf of Williamson County and Travis County in the Austin area. And we're also in Dallas-Fort Worth in the 6 counties that you see there: Dallas, Tarrant, Collin, Ellis, Denton, and Grayson. We are in the Rio Grande Valley, so Nueces County, which is the Corpus Christi area, Webb County, which is Laredo, and then Hidalgo, Cameron, and Starr. And that's really been a huge area of growth for us this year. We just entered the Rio Grande Valley, already have a great number of members there and continuing to grow that every month. That's one of our hottest markets right now. And then we have plans in the Houston market, in Harris County, Fort Bend, Brazoria, and Montgomery. And we also have plan options in El Paso and Lubbock counties for your clients.
Agents, if you're listening to this and you're down in the valley, and you're thinking, God, I'd love to have a little help in Spanish. Hablamos español, te podemos ayudar. So if you're thinking, hey, I'd like to get a little training, my English is not so great, I need a little help in Spanish, we can help you guys.
So all Friday health plans include comprehensive major medical coverage, all of the essential health benefits that the Affordable Care Act requires to be covered. So your clients are going to have prescription coverage, hospitalization, outpatient, lab, preventive care, emergency services, rehab, pregnancy, maternity, and so forth. Just a side note on prescriptions, like all carriers, we have a formulary. So just check if your client's medication is on the formulary, because not every single prescription is covered, but we do have a very generous formulary, and we do have prescriptions covered in every therapeutic category.
So Sonia mentioned that they're an ACA approved plan, which means pre-existing conditions are covered, guys.
Yes.
Okay, so you don't have to worry about them having a health condition and maybe not having it covered. So that is huge. Now, the one thing that I get a ton of questions on, because the cards will say vision, and is there pediatric dental on these?
Just the vision.
Just the vision. Okay, so you see pediatric vision. Is that a full-blown vision, or is it just a preventative vision? Is an eye exam? So
it's an eye exam and 1 pair of glasses per child per year. We actually also offer adult vision on all of our plans this year, which we'll talk a little bit more about later.
Beautiful.
It's a differentiator for us from our competition.
Great.
So as I mentioned, all of our plans include comprehensive major medical coverage. We've got some member wellness extras that we'll talk a little bit about later. Not quite a rewards program, but basically fitness and healthy eating discounts. All of our plans also include unlimited telemedicine through Teladoc for $0 copay, even on the HSA plan. So virtual doctor visits would be $0 on all of our plans. Many of our markets have a service called Dispatch Health, which is really cool. It's basically a concierge urgent care that comes to your house. So you have the option either to go to an urgent care facility or to have Dispatch Health come out to you. And that's available in DFW, Austin, San Antonio, and Houston. And it's available for the same benefit as a regular urgent care visit. So if a client's plan has an urgent care copay, then they can call Dispatch Health out and pay that same copay. Or if it goes towards deductible, it'll work exactly the same as an urgent care. We don't exclude pre-existing conditions, like Luis mentioned, and we have a national access program for out-of-area students and employees. So because we are still expanding, we're not in every part of the country or even every part of the state. You may have some clients who are concerned and say, well, my family lives in San Antonio, but I have a son or daughter going to school in California or New York or wherever the case may be. We give them access to a national access program so they can still use their Friday health plan as if it was a network where they are located. That's specifically for out-of-area students, or if it's a small group plan for employees who live out of the service area.
Very, very cool.
And we have local Friday representatives such as myself who live in the markets that we serve and are here to help you. So we're really known for our $0 benefits. That's one thing that Friday kind of led the way with in the Texas market. Unlimited $0 primary care on many of our plans, most of our plans actually. So some carriers will give you maybe the first visit is $0 or the first 3 visits, and then after that you're going to pay $50 every time you go to your primary care. For our plans that include this benefit, it's unlimited $0 primary care visits in network. We also have unlimited $0 mental health visits on many of our plans, and we include a huge network of therapists and counselors, psychiatrists and psychologists in our network, because we really believe mental health is just as important as physical health. We want to take care of the whole person, right? Especially in these difficult times. So that's a huge benefit as well. We have $0 generic drugs on many of our plans. As I already mentioned, unlimited $0 telemedicine through Teladoc on all of our plans. We talked about the adult vision benefit a little bit earlier. So many plans include pediatric vision, or the ACA requires them to. We include an adult vision exam as well for $0, and that is through VSP, which has providers all over. If you're familiar with vision insurance at all, so every adult on a Friday plan can get one free annual vision exam, and then of course the $0 annual wellness and preventive care as well.
So you mentioned that point, $0 unlimited visits.
Yes.
A ton of carriers will say 0. But they have a limit on how many visits that you can see per year. So it gets confusing because they'll go see 3. I know one carrier has 3 visits. After the 3rd one, it jumps up quite a bit. And then you're getting that call. Why did my copay go up?
Exactly. Yeah. So we don't want anyone to ever feel like they can't go get that basic care that they need because, they might not have the $50 or whatever after a certain number of visits. So we want to make sure that they have that access.
Got it. Good.
And here's an overview of the plans that we offer. So these are the 9 plans that we offer on the Texas marketplace. We have a catastrophic plan that's only available to your clients under age 30 or who have a hardship exemption from the marketplace. So it's high deductible. It has some $0 benefits like the preventive care, the annual vision exam, the telemedicine, and the preventive ACA drugs, which if you don't know what that is, it's any medications that Affordable Care Act requires to be covered 100%, such as birth control. But a lot else is going to go towards that deductible of $8,700 for individual, 17,400 family. And so that is a great plan for maybe someone turning 26 and aging out of their parents' coverage, and they just want something really basic and affordable to have coverage in case something happens. And then we have 4 bronze plans. We have a bronze basic. We have a bronze plus, which is where you start to see some of those great $0 benefits that we mentioned, like the unlimited $0 primary care and mental health. It's got an urgent care copay of $75. It's got a preferred generic copay. And then we've got our bronze plus copay. If you have anyone that wants a bronze plan, but they want to have a specialist copay on their plan, this plan does include a specialist copay. It's $150, so it's a little steep, but it's a bronze plan. A lot of specialist visits can cost $200-$300 or more, right? So they're still saving some on that and knowing exactly what they'll pay to go to an in-network specialist. And this plan also includes copays for preferred generics and for preferred brand. And then if you have a client who wants an HSA eligible plan, we've got our bronze HSA. The deductible is a little lower. Not a whole lot is covered until the deductible's met because it is an HSA plan, but they still get the $0 preventive care, annual vision exam, telemedicine, and the ACA generic drugs, preventive ACA drugs, excuse me. And then we've got 2 silver plans. We've got our regular silver and our silver copay. Our regular silver has a little bit lower deductible, $5,500 individual, $11,000 family. And it's got all the great $0 benefits that we've talked about already. And then there's a little bit of a coinsurance percentage between the deductible and out-of-pocket maximum. So if it's for something like hospitalization or a preferred brand, it's going to be an 80-20 coinsurance after deductible up until the out-of-pocket maximum. Or if it's an emergency room visit or non-preferred or specialty medication, it's going to be 50-50. Our silver copay plan is very similar, except now you have a copay for specialist visits as well as all tiers of medication, even specialty, we have a copay for on the silver copay plan. So it's a little bit steep of a copay, but a lot of specialty medications, remember, are several $1,000s a month. So we're limiting, the client is going to know exactly what they're going to pay. And finally, we have our 2 gold plans. Our gold is pretty much identical to the silver, except that the deductible is even lower. It's $2,300 individual or $4,600 family. And then our gold copay is our richest benefit plan that we offer on the individual market, not including our cost sharing versions of our silver plans that we'll talk about in a second here. But it's going to have a copay for specialists as well as all tiers of medications, all the great $0 benefits we've talked about already, and a deductible of $2,300 for individual.
Now, these are the plans without any CSRs,
Correct.
those cost share reductions that you get if you qualify income-wise.
Correct. Yes. And then here are the CSR plans. So for your clients who are taking advantage of the SEP based on income this year, they're going to be seeing more of these versions of the plan. So as you can see here, we have the silver and silver copay, 73% CSR, 87% CSR, and 94% CSR versions. Most Friday members are in the state of Texas are on either the silver 94% or the silver copay 94%. Now the deductible is $0 because of the cost sharing. The out-of-pocket maximum is $2,900 for an individual. It has all the $0 benefits we talked about, but in the silver copay 94%, for example, only $20 for a specialist visit. We're looking at 90/10 coinsurance for the services where there's coinsurance. So it's much richer benefits. So, don't be scared off by some of those bigger numbers that we saw in the previous slide. Most of your clients are going to be looking at these versions of the plan, especially if they're enrolling under the new income-based special enrollment period.
And guys, you don't have to worry about figuring out which plan you're going to put your insurance in. Health Sherpa, which is our preferred method of quoting, is going to do it for you. So once you enter the household information, the income information, and who wants coverage, the software is going to do it all for you, and it's going to let you know what plan they're going to qualify for.
Exactly. Yes, it'll be right there for you. And so you may be thinking, hey, these plans sound great, but what doctors can my clients go to, or what network can they use? So as I mentioned, we've got one network for all our plans in the state of Texas. We don't have network reciprocity between states yet, but within Texas, they can use any Friday network provider. Obviously, they have emergency coverage if they're traveling. Our network is also an EPO. So this is an important point. It's not an HMO like some of the other carriers, right? It's EPO. And we find that our members really prefer that. You don't need referrals to see specialists. You don't need to designate a primary care provider. So it's just fewer hoops to jump through for care. Pretty much as long as the provider is in the Friday network, your client can just go ahead and go to them. So
I'm going to do a little healthcare 101 with you guys. So PPOs, they're pretty much non-existent in the ACA world. Okay. They do exist in the group world, but not in the ACA world. Now, in the ACA world, you're going to have HMOs or PPOs. HMO is a closed network. You can only go outside of the network for emergency care. Okay. Normally, there's some exceptions. I think one carrier has an exception to that rule. They got a plus plan. But on the EPO, it's still a closed network. Okay. Just like the HMO, but you're not required to get referrals for specialists. So it is a hurdle that a lot of insureds don't like to deal with. So it's a good thing we don't have to deal with that on the Friday health plans.
Exactly. Yeah. We're just trying to remove those barriers to care. So, and the adult vision benefit and pediatric vision benefit is through VSP, which they have their own network. So you can always go to VSP.com to search for eye doctors that apply to that.
And that is one of the largest networks.
Oh,
I mean,
yeah.
I've never seen an optometrist or an eye center not in the VSP network.
Exactly. Pretty much everybody takes them. And so just high level on some of the hospital systems that we have in our network. In the Dallas-Fort Worth area, we've got the Medical City and Methodist and Crescent hospitals. We also have Cook's Children's and Texoma. In the San Antonio area, we've got the Methodist and Baptist hospital systems. And when we contract a hospital system, we contract all the locations and all their downline physicians. So anybody that is under that network should be included in our network as well. In the Rio Grande Valley, we've got Corpus Christi Medical Center, Doctors Hospital of Laredo. I won't name all of them. You can see them there on the list, but we've got a lot of the major ones that are present in the Valley. In the Houston region, we've got HCA, Texas Children's. To my knowledge, we're the only ACA carrier that has Texas Children's in our network. So that's really huge for us in that area. They're very well known nationwide, even as a pediatric care provider. In Austin, we have St. David's Healthcare, which is the top hospital system in the area. And then in El Paso, we've got Los Palmas del Sol, El Paso Children's, and now Providence Health. And in Lubbock, we have the University Medical Center Health System.
And guys, on the network, okay, and let's confirm this. Now, I've been doing health insurance for more than 20 years. Networks some insurers get a little sideways with the network. Okay. If you're in an emergency, you're not going to tell that ambulance to take you to a network or a facility that's in network. They're going to take you to the nearest facility.
Yes.
There's no issue with this when there's an emergency type situation,
Exactly.
correct?
Yes, for emergency, they're covered wherever they are, emergency room, hospitalization. But when we're talking about the network, it's for something that they can plan for ahead of time, maybe a scheduled surgery or non-emergency situation.
I'm going to have a shoulder surgery in 3 months. Well, yes, you've got to make sure that surgery is going to be set up with an in-network provider.
Exactly. And so if your clients are looking for a doctor, we talked about the hospital systems, but let's just say they want to find a primary care or a pediatrician. I just want to go through a few screenshots of how our provider search works so you guys know, so you can help your clients with this. So you start off on FridayHealthPlans.com, go to the health plans tab like you see there, and then click on health network. And then if you would go to the next one, these will go pretty quickly. And so first you'll select the state. Go to the next slide there. And so you can see our 7 states there. So you just click on the one that you want and then keep going. And it'll give you the option to search for doctor by name, by specialty, or places by name, or places by type. So if you're searching for doctor by name, I recommend putting in just the last name because that's going to be the best results. If you put first and last, sometimes it's not going to find them if it's not in there exactly that way. So I always just search for the last name and then find them. Doctors by specialty, you could type in something like pediatrician, OBGYN, allergist, cardiologist, whatever the case may be. Places by name, you can just start typing, Baptist Healthcare or whichever one. And then places by type would be for hospital, urgent care, and lab, for example. Do remember to change the location. So at the top right, a couple slides back, it showed that sometimes it defaults to Alamosa, Colorado, which is where our service center is. And then you're looking and you're like, why isn't anything coming up? So just a tip on how our provider search tool works, just make sure to change the location. So in this example, right there, yeah, see it says Alamosa, Colorado, top right. You would click on that location and then it's going to ask you to change it on the next slide. And so you type in this example, I was looking in Houston. So you just type in, you click the green button, and then you keep going. And now it's searching within 25 miles of that area. And so in this example, we're looking for a pediatrician in Houston, Texas. We just type in pediatrician, and then the next slide shows you the results. So you can see how we have over 600, almost 700 in-network pediatricians just within 25 miles of Houston. So that's just an example. You can play around with a provider search and see for yourself, but we do have a lot of in-network providers available for your clients. We get a lot of questions about our broker portal. So our broker portal is a work in progress. We are working on giving you guys some of the tools that we've been hearing from brokers that you're wanting, to make your life easier. Right now, your Friday broker portal is mostly for quoting and enrolling. So you can quote and enroll on Healthcare.gov, on HealthSherpa. Once you know they want a Friday plan, you can also do it directly on your Friday broker portal. That's for both on and off exchange. We do have an EDE on our broker portal, so you can enroll them right on our site if you want. It's not going to show you your book of business just yet, but we are going to launch new features later in the year that will enable you to see your full book in your Friday portal, as well as see client status, what's their pay through date, things like that, and even download ID cards for them.
That's going to be huge because ID cards, we get those questions. I need my ID cards. I'm like, they sent them to you.
I know.
And they're like, well, I didn't get them. I'm like, okay, you got to call broker support or customer support.
Exactly.
To get that.
Exactly. So in the meantime, until your book of business is in your Friday portal, a lot of you, if you have any clients on the books with us, you're probably getting these emails every week, just so you know where to look. It's coming from no-reply@FridayHealthPlans.com. It's got the subject line, secure your Friday Health Plan roster. There's going to be an Excel file attached to that email that has your members' information, including their member ID number and their enrollment status. And especially be on the lookout for anybody that says awaiting binder payment, because that means they haven't paid their binder payment yet. Definitely please encourage them to pay that so that their policy goes into effect so that you get paid on that enrollment.
You will not get paid until they pay.
Yes.
And
exactly.
Also, correct me if I'm wrong, they're not going to get ID cards until they pay.
Exactly.
Okay.
Both of those are true. So we want them to pay. You did a lot of work to enroll them, so we want to make sure they go into effect. So here's just a little bit. If you haven't signed up for your Friday portal yet, your broker portal, you can go to that link that you see at the top there and then click create an account. It's going to ask you to, put in your email. You do want to make sure that's the same email that you got appointed with, that you did your contracting with Friday with, and then create your password, and then it'll create your account. And once you log in, it's going to look like this. So you can see there right now, you can start an application, you can start a quote. If you enroll a client through your Friday portal, they will go ahead and be in there. But anybody else is just going to be in those email reports, just so you know. As you're going through the quote process, you can see here, when you're going through the on-exchange route, it's going to go ahead and give you a subsidy estimate for them. We always, caveat that with saying it's an estimate, so they got to go through the whole application to make sure they qualify for that and how much they qualify for. But as you go through the process, you'll see they can go ahead and get the subsidy right through your Friday broker portal if you're enrolling them that way and they qualify.
This is if you're enrolling them on your site.
Yes.
Not HealthSherpa.
Yes. Yes, these screenshots are from our site, but it's a similar process. It's just, this is just a little bit different. And this is just an example of our plans on there, and you'll see that the prices do include the estimated subsidy already. Your clients that qualify for cost sharing, that only applies in the silver plan. So we recommend, if they do qualify for that, to go ahead and add a filter for silver. That way you're only showing them plans with those extra benefits. So this screenshot is an example from healthcare.gov of doing that.
Guys, this is a huge pro tip here, okay? You gotta be aware that if an insured qualifies for CSRs, cost sharing reductions, you have got to stick to silver plans. You may think, well, I want to put them into gold because gold is supposed to be richer than silver. Well, not when they're getting cost share reductions.
Exactly.
So make sure that you're focusing on silvers when you see that CSR badge on HealthSherpa. Okay, just FYI.
That's a great tip. And so here's just another screenshot from healthcare.gov showing you how to do that. And you see you have the silver selected there. You apply the filter, and then it's only going to show you those silver plans. So you don't even have to worry about weeding through the other ones.
Guys, and we're going to train you on this. You just need to, if you're going through healthcare.gov and you're going the old ways, what I call it, you're behind the time. Okay. You need to get with us. We'll help you we'll show you how to use HealthSherpa. And because your quote time, I think I spend 10 minutes at the once I figure out what they want, and we've done all the research with HealthSherpa. Maybe 5, depending on how many people in the household, but I can knock out an app quick. And then I love it because it tells me their status. I can get their document, any documents that need to be uploaded. It is one heck of a tool. So, yeah, the old school way, healthcare.gov. I tell agents, stay away from that unless you have to. Sometimes you don't have a choice.
Right. So there's all different ways to quote and enroll. Like Luis mentioned, HealthSherpa is a big one. A lot of agents like to use. That's an EDE. You can quote them through our site, through healthcare.gov, through Benefit Align, quote it, any other EDE platforms that are out there where our plans are on there. And as we mentioned earlier, it's very important for your clients to make their premium payment, right? That's how they have coverage. That's how you get paid. So assuming that they don't have a $0 premium, but if they do have a payment to make, there's several ways for them to do that. We have a new Pay Now tool where one-time payments can be done. You do have to have the client's member ID number, but they don't have to log in. So either they can do it or you can do it with their permission, right? And remember, their member ID numbers are on that book of business report email that you're receiving every week. You can't set up auto pay this way. It is only for one-time payments through the Pay Now, but auto pay can be set up either through the members portal or through their app. So I know we have a lot of brokers who are very hands-on and help their clients create their portal, or they can do it themselves. Either way, but we have both credit card and bank draft options as far as payment options, or your clients can follow one of those steps on the right as far as calling the phone line to get assistance. We have an automated payment line, or they can speak with a live care crew representative and set up auto pay that way. If they're super old school, they can even mail a check, but that's a last resort because that'll take very long.
Definitely last resort. Do it online.
Yeah.
Pay now, or do the Pay Now. We do this all the time for our insurance, so it's huge.
Exactly. And you can see here what our Pay Now tool looks like. So you just go to our main page of our site. It's right there at the top right where it says Pay Now, and then you choose to pay with ACH or pay with credit card.
Again, remember, guys, you don't get paid until they pay their premium. And they don't get their ID cards until they pay their premium.
Exactly. And so in this example, we're showing, someone trying to pay by credit card. You put their member number at the top, first and last name, their date of birth, their email, phone, and then the payment amount. So it does have you input the payment amount. So they can pay for 1 month, they can pay for as many months as they want. If you have clients with a super low monthly premium amount, like maybe 50 cents or $1, we recommend they just go ahead and pay for the whole year. That way you're not worried about them falling off during the year or their coverage getting lost because they forgot to pay, 52 cents, right? So you can go ahead and put that payment amount to be whatever you want and they want, and knock it out. And then put the credit card number and the expiration date and all that stuff, put the little box and click submit, and there's your payment.
Here's a question. My insurance, I will pay the full 12 months. I'll give you $6, assuming it's 52 cents a month. Can they do that?
Yes, absolutely.
Oh, there we go.
Yes, and we encourage that.
Okay.
That way you don't have to worry about it later. They don't have to worry about it. Nobody forgets. It's all done. They're covered for the year.
Perfect.
Now, sales materials. We have a lot of sales materials available to help you guys with the enrollment. So if you go to FridayHealthPlans.com, go to the brokers tab and go to sales materials. We have brochures available in English, Spanish, even Vietnamese, simplified Chinese, right? We have large and small brochures. Some of the brochures show the cost sharing reduction plans. So you're probably going to want to look at those for a lot of your clients. And then we have flyers on there for the VSP Vision benefit, the Dispatch Health, all of our kind of extra benefits. There's a lot of great stuff in there. So definitely encourage you guys to check that out. Here's what the member portal looks like. If you're a very hands-on broker and you're helping your clients to set up their member portal, this is where you go, right? So FridayHealthPlans.com, again, go to the login and choose members. And then if you would go to the next one, and then it'll look like this, and you just go to that purple member portal login button. And then on the next slide, it shows you how to create their account. So you can either, help them log in if they have an account, or go to not yet registered and create their account for them. We do have a workaround. If any of you have clients who don't have a social security number, it's going to ask you for their social security number, but we have a workaround for that. Just have them call into our care crew, which is our customer support, and a care crew manager will create their account on their back end, just in case you have anyone in that situation. Once their account is created, it's going to look like this. They can see where they're at as far as their deductible and out-of-pocket maximum accumulation. They can look at their claims. They can get their ID card right in there, use the provider search, do a plan change through the special enrollment period, and so forth. And through this, just bear in mind, it'll only let them change from one Friday plan to another, but who would want to change away from Friday, right?
And run up this up your chain of command. Agents would love to have that information on our insurance.
Yes.
I don't know who have access to it, but it'd be nice to know where they're sitting at.
Yes, and we don't generally provide claims information to brokers, but we are looking at a way to provide, payment status, the ID card, and the broker portal. Those are all things that'll be launched later this year that we're working on. So when they do go to get their ID card, this is what it looks like. They can see the front of it right there. They can flip it over, and it looks like that on the back there on the bottom right. And that back of the card is the same information for everybody, and then the front will be specific to them. If you have clients who like to use mobile apps, I know we've got a lot of folks who maybe they're on their phone more than they're ever on a computer, right? They can download the Friday Health Plans app in the Apple or Android App Store. It's going to have all that same great information for them. Just know that they do have to have a member account first in order to link the app to their coverage. Here's a little bit about our wellness extra. So I talked about how we have some fitness and wellness and health related discounts. So there's discounts for healthy eating or for yoga or, exercise and all different kinds of things that your clients would have access to through their Friday membership.
What do they get actual monies that they can use?
It's more of a coupon or a discount that's specific to Friday members. So we work out deals with some of these vendors to give our members access to different services. Okay. Here's our broker support unit. So for you as an agent, if you need anything, you can contact broker support, and they're based out of Alamosa, Colorado. I've got that phone number there, or you can email brokers@FridayHealthPlans.com. They can help you through the appointment process, issues accessing your broker portal, network questions, claims questions, or commissions related questions. We also have our local Friday team. So as I mentioned, we have local reps in each market, and we may be adding some new ones here soon. But for right now, we've got myself, Sonia Porras. I'm the sales manager of West Texas. So if you're a broker in San Antonio or Austin, feel free to reach out to me. Sabin Lopez is our sales manager of East Texas. So he's covering currently the Houston area as well as DFW. Johnny Sines is down in the Rio Grande Valley, and El Paso is the senior sales executive. And Alex Blanchard is our sales and marketing coordinator. So she can hook you up with swag or marketing materials, if you need some printed brochures and things like that. And over on the right, we have general contact information for getting appointed, for broker support. So broker support is who you reach out to as an agent. And then we have our care crew, which is our customer support. So if your member wants to call somebody, they can call the care crew and get assistance. And then at the very bottom, we have the quoting email. If any of you write small group, you can reach out to that email for quotes. But both the broker support and care crew are available 8 a.m. to 8 p.m. Central Time, Monday through Friday.
And Matt, let's talk about our meeting. We have what, 2 weeks, 1 week?
Yes, Johnny Signs will actually be there
Is he? And he better show up with some swag.
with some lots of swag.
We need goodies. Agents love goodies. So guys, yeah, if you're in the Rio Grande Valley, we're going to be having a meeting. Was it next week, Matt?
On Saturday, April 2nd.
Saturday, April 2nd. Come join us. Whether you're with us or not, we'll teach you everything we've got. And if you're not doing this and you want to learn about it, come and join us here. Hit me up on the email or on post comments down there, and we'll share everything with you. Let's do the next slide, man.
Yep,
I think we are
yes,
good.
we're at the question and answer portion.
So
Anything I didn't
here's
answer?
the question. I'm thinking as an agent. Well, first of all, how do I get started with ACA? So like, I like this. I want to do it. We're not going to talk money here right now, but there is a lot of money. Okay. It used to be in the past where commissions were not good. Commissions are super healthy. Okay. So we get paid on a per member per month. And I'm just going to throw out a dollar amount because it varies across the board, different areas, but we're getting almost $20 or around $20 a head per month, guys. You go write mom, dad, and 2 kids. You just made $1,000 commission, and it probably took you no more than half an hour to write that. Gosh, there's a ton of business to be written out there. Okay. So if you want to get started, comment down below. We will set you up with contracting. And then we also provide training. Not only do we bring in carrier reps to talk about their plans with us, but we have our own training program. Okay. It's a 4-week course that we'll run through. We'll do it once a week, every Wednesday, 8:30 a.m. Central. We do it on Zoom. We'll train you on how to sell ACA plans. I also have a course on that I sell. But when you contract with us, we will give you this entire course online. So if you want to accelerate your training and get it all done in one day, we'll give you a login and password and a coupon code so that you can get this training program free because you're contracting with us. So guys, you haven't missed the boat. Okay. You have not. Okay. It sailed, but it came back. So now you can take advantage of writing business all year long. Get set up right now. And in addition, be ready for OEP next year. And then here's another thing. You Medicare guys out there, and you're thinking, I don't want to do ACA. I don't want to mess with this. Okay. Where is the golden or the pot of gold at the end of the rainbow for Medicare? Matt, what is the pot of gold? Okay. Matt's over here. He's our mouse clicker. And I don't have a remote, but the pot of gold for a Medicare agent is turning 65 leads. Okay. It doesn't exist. Okay, if you're getting a list, you're probably getting one that has been picked over by so many internal agents and carriers. All you're getting is, you may find a needle in a haystack, but if you want to build your own internal pot of gold for Medicare, there's no other place to do it than having your ACA book of business, your own group of people that are going to age into Medicare at some point. This is the single best source of leads that you can get. You can go by direct mail. You can do grassroots marketing. All that is awesome, but nothing beats your own internal book of business that you can have access to, that you can compliantly call at any time because they're your clients. They trust you already. So if you're not in the ACA space, guys, you're a Medicare guy or you're a P&C guy, and you're like, I don't want to do this. There's no money in it. Guys, there is a ton of money to be made in ACA. So comment down below. My email will be down there. Get a hold of us. We'll get you set up and we'll show you how to write business and make a ton of money and grow your book of business. Sonia, thank you for being with us today. If you guys have any questions, hit us up with the comments. We'll be glad to help, and happy selling. All right, guys, if you like what you saw, here's what I'd like for you to do. I've got some extra videos here for you to watch. And if you would, click here so that you can subscribe to our channel, and make sure you hit the little bell icon so you can get updates like these in the future.